Hello, and welcome to Learning the Social Sciences. Today we'll be looking at the 1918 Spanish influenza pandemic. Now, the 1918 influenza pandemic was the most severe in recent history. We are right now in another pandemic, the COVID-19 pandemic. The differences between the two is COVID-19 is a virus, while in 1918 this was an outbreak of a very severe form of influenza. Now, we have had other pandemics since 1918. There's one that happened in the 1950s, and another one, the Hong Kong influenza of 1968, but we have not had anything as severe as the 1918 since until now, most recently with COVID 19. So going back to 1918, it's assumed that around one third of the world's population had the virus, and around 50 million people died of Spanish influenza. There are fluctuating numbers with that. Some people go lower than 50 million, and some people go up to 100 million. So I went with that kind of middle ground of 50 million here. However, within the United States, where we had census records and were able to truly track the numbers, it said that 675,000 people died within the United States of Spanish influenza. So where did it come from? There's various theories as to its origin. Now, for a long time, people assumed that it started at a camp in Kansas in the United States. Other people thought that it started in the trenches of World War I in France. But other people tracking the illness said that it probably is linked to a respiratory disease that first took hold in China in 1917 and then was brought over due to World War I over to Europe with people brought over there from China. So nobody knows exactly where it came from still today. However, we have collected samples of the Spanish influenza, the H1N1 virus, and we have tracked it down. So there is a Alaskan village, Brevig, and this village was very devastated by Spanish influenza. In fact, Alaska was simply devastated by by the second wave. We'll get to that of the 1918 outbreak. Some Alaskan villages lost up to 90% of their population, and more people died per capita from Spanish influenza in Alaska than anywhere else in the world. However, there was this one place, Brevig Mission, out in Alaska, where 72 out of 80 people died from that village. However, the people were buried in permafrost. They were buried in a mass grave, but in permafrost. And so scientists, they first tried in the 1950s, but then in the 1990s, they were able to actually take out a person's lungs from that mass grave that did not decompose because of the permafrost, and they used that to track the history of Spanish influenza, finding that it first originated in pigs, but it actually got to humans through birds for tracking that illness because they obviously found swine components and avian components within it. And they did use this for developing a vaccine for Spanish influenza, but they have not been able to truly map out the virus from the Brevig mission samples because they only had one set of lungs that they were able to get from that. Now, H1N1, because I have mentioned that, you might think that sounds a little familiar. Yes, we did have the swine flu H1N1 outbreak in 2009. It obviously was not Spanish influenza, but it's a related strain. So because this strain is related to pigs. So that 2009 swine flu pandemic that came, we lost in the United States 12,469 people, and worldwide, again, the numbers fluctuate from around 151,000 people to 575,000 people. But we do have now a flu shot that is, available to all to combat swine flu, the 2009 version. So again, the origins of where it broke out. Medical historians and epidemiologists have a strong theory that it did originate in northern China in 1917, and it moved west with the 140,000 Chinese laborers that the French and British brought over to Europe during World War One. Others state that it started in another area of China where they reported pulmonary disease, and a different group of Chinese and Vietnamese workers that were brought to Europe also. But either way, for these theories, it's starting in China, 1917, and brought over to Europe with laborers that the Europeans needed to help during World War One. So other theories include it starting at a British Army base in France at the trenches. However, since we do have this longer track record with the China one, this one is starting to be not as popular. Also, not as popular, but stated for a long period of time, is that it started at a military base in Fort Riley, Kansas, in March of 1918. So, when we're thinking about like historiography and how history can change once we learn new information, looking at just the origins of the Spanish influenza, you can see the change that occurs over time in terms of how the history of where the disease started has changed itself. So, how in the world did it get its name? If it's starting in either the trenches of France or a military base in the United States or starting all the way in China, how in the world is it called Spanish influenza? Well, a whole bunch of places did not want to report that it was striking and that a whole bunch of people were starting to fall ill and die. Despite the fact that the 1918 flu wasn't isolated in one place, it became known around the world as Spanish influenza, as Spain was one of the earliest countries hit hard by the disease and finally wrote about it in their newspapers. They, like other countries, tried to hide it and didn't want it in the newspapers, but finally they talked about it and the newspapers published information about it. Even the king of Spain contracted the flu. Now, so then American newspapers started to call it the Spanish flu. Well, it's kind of funny. In Spain, their newspapers were calling it the Soldier of Naples. Naples, Italy? What? So different places were calling it different things in its early years. If you would ever go and try to track primary sources for Spanish influenza, either way, it traveled across the world quickly, mainly because World War One. Soldiers started to return home, and with that, with soldiers returning home, we were having, this disease spread so fast to various locations. So World War One ended in on November 11th, 1918. The flu spread as soldiers brought it with them. So, a theory is that the stresses of combat and conditions increase soldiers' vulnerability to the virus. And of course, the modern transportation system made it easier to spread the flu to various locations. So, the flu had killed 57,000 American soldiers, which is 4,000 more than those were actually killed in World War One itself. And a total of 25% of Americans are going to be getting Spanish influenza. And once you got it, it was a horrible strain of influenza to get, mainly because it targeted the young. And places when it hit were often overwhelmed. Their nursing staff, their doctor staff, other places were having to build various locations to house the sick. Now, some areas were kind of equipped for it, while other areas were dealing with other issues. For example, in northern Minnesota in 1918, right before Spanish influenza hit, they had one of the worst fires in the history of the United States. It went through areas of northern Minnesota, killing hundreds of people. And these people then became, or that the people that then survived became refugees and went to places like Duluth, Minnesota to be able to find shelter somewhere after their entire city, town, farm, whatever burnt down due to this fast moving fire that happened in October 1918. Well, the Spanish influenza showed up 2 weeks after that fire in Duluth, Minnesota. And so you had this refugee population that was all together already in these locations that probably would have been overflow areas for setting up beds and facilities for the victims of Spanish influenza. However, they're now the refugee locations. And unfortunately for the refugees, Spanish influenza, because they're all housed together, quickly went through their population as well. So, the people it affected. The flu was very unique as it targeted the young and healthy. Traditionally, a flu is going to go through, and people over the age of 65 or 55 even are going to be the ones that are going to be hit the hardest. However, with Spanish influenza, the highest mortality rates are among people age 20 to age 40, the people at the prime of their life, the people that are the strongest, the most physically fit. And so people have been asking, why in the world are the healthy the ones that are dying the most of Spanish influenza? So again, we have two theories. There's probably more, but I'm just going to focus on two right now to keep it simple. So some people have wondered if maybe there was an earlier strain that went through maybe decades and decades earlier that was very mild. And people were then able to build antibodies, but those people would have been over the age of 40 by time 1918 hit. Um, the main theory, though, is that really it's how the body reacted to Spanish influenza, that the body simply overreacted when trying to heal itself. And that overreaction is then what would cause the lungs to start to be filled with fluids. So that is the main theory as to why it really hurt the population of people that are aged 20 to 40. So half of all deaths in 1918 were people between 20 and 40. And now, if you're thinking about that, think of all the children whose parents are going to be dying and the sheer amount of orphans that we are going to have worldwide because of Spanish influenza. So, like I just mentioned, the deaths usually came from that overreaction of the immune system. So, what were the symptoms? Well, what doctors and nurses noted was a blue tint to the face of the people that were suffering from it. And they had that because they are literally drowning in their own fluids. Their lungs would fill up with various fluids. Now, some people did have some other symptoms. Some people had their stomach or intestines hemorrhage. Some people had strokes because of it. Some people wonder if the stroke, the minor stroke that President Wilson had in 1919, may have been related to Spanish influenza. Of course, you can't prove it, but the theory's out there. People would be coughing up blood, and as they turned more and more blue and their symptoms would increase. Some people would get bloody eye sockets and other things. Death would usually occur in hours or the next day. In October 1918, really the influenza was just racing through, and it was the deadliest month in U.S. history with 195,000 fatalities. The flu spread so quickly that healthcare workers became too sick to take care of their patients. In some locations, like I talked about, Alaska getting so inundated in the later waves, that you had people that were caring for other people, and they would just simply, while they were trying to go between beds of family members or of people of the community, would they themselves just simply pass out and die on the floor because of how quickly it would hit. So it is estimated between, like I talked about earlier, 50 to 100 million people died of Spanish influenza. The lowest estimate is around 21 million. And there are not enough records to adequately know the actual true number. That's why we have these fluctuating numbers. So, like I've been mentioning, there were various waves of the flu. The first wave was mild compared to the last two. The first one is mainly what you're going to be seeing at those original locations. However, the second wave was the one with the high fatalities because that is when it booms out worldwide. And if you're thinking about it, the second wave happening in the fall of 1918, that's usually when influenza is starting to come around anyway. So we had it back in the spring, back in March of 1918. Then we had the warm summer months and the numbers go down. But then, boom, when fall hits again, the numbers just rise up quickly. We do have a third wave that hit in March of 1919 and spread throughout England and Wales in Europe. And again, that is when people are guessing maybe that's why Wilson had that stroke, as he was in Europe at the time for the Treaty of Versailles negotiations. So you could just see from this primary document from this source of the mortality rate in America and Europe during 1918 and 1919, and just the sheer amount of deaths as they spike up with that second wave. So mortality by country, what we do know. India, it's estimated to be around 17 million. You can see the United States at 675,000, and the other nations, some of them, of course, are not entirely 100% right. And like I've been saying, Alaska, which was just hit super hard, entire villages would have just perished. There was one village where, by the time they got to them up in Alaska, um, and they went to the 10 houses, something like that, of the people that lived in this village. They only found two survivors. One was a baby that was still cuddled up and trying to nurse from its dead mother, and another was a young child who was there. And those were the only two survivors from that location. So we have very sad stories, but we have also places that were simply not hit. There were some very rare Alaskan villages that just never got it. And there's other places that just did not get hit hard. So a lot of people look at Princeton University, New Jersey. Princeton itself, the village, the town, because it is in the town of Princeton, had people that did succumb to Spanish influenza, but on the actual campus itself, they really practiced social distancing, and they had this area that people would have to go through, and they would have to take off all of their clothes, and their clothes would then be disinfected for over 24 hours. And they had this long process just to get on campus. And so on campus, they had zero deaths. They did have some people come down with it, which were immediately removed from the population, but they had no deaths. And so people still look at that today. And as we are right now experiencing COVID-19, when you're talking about social distancing, you have people that look at Princeton University and other places, like other villages and towns in Colorado and other locations that were simply not hit or not hit hard, simply because people were not around other people. So the impact. The panic caused large business failures and stunted economic growth for years after. That's what happens when a pandemic of this magnitude hits. People began to listen to authorities on public health and started to really take precautions, just like right now with COVID-19, everybody's being told about hand washing, constant hand washing, and other various measures to protect yourself. If you go to the grocery store and you bring groceries back, then you should wash and clean them before putting them away. For example, pull out your Clorox wipe and wipe down your milk before you put it in your fridge. Research and testing is still being done today by recreating the virus for research and studying historical tissue samples. So, scientists have been trying to find Spanish influenza in the flesh of victims, like I talked about earlier. And they did have some places that the United States was keeping and maintaining, but those were very small tissue samples and didn't really work. It was truly the area of Brevig, Alaska, that was able to give those samples of the people that were buried in the permafrost to be able to find out some things from the influenza itself. Unfortunately, these recent attempts to fully map out Spanish influenza have not been successful, but we have been able to create a vaccine if ever need be. And we have been able to find out its kind of history with having swine and avian components to it. So thank you very much for watching. If you have any questions, comments, please leave them down below. Thank you very much.